Now I want to talk about a different form of randomization called cluster randomization. This occurs in what are called cluster randomized trials. Cluster randomized trials arise when it's very difficult to treat patients in a particular group in a different way. So, for example, you might have a surgeon who's trained in a particular technique. Now, all the patients with that particular surgeon will be operated under that technique. It's very hard to tell a surgeon by using randomized cards to use one operation or another depending on the turn of a card. So the surgeon will be trained in one particular technique, they'll use that technique. Similarly, if you go to your GP may be trained to actually recognize, for example, depression or diabetes, and then it'd be very difficult for this GP to switch off this knowledge for some patients at the turn of a card. A similar sort of thing would be when you're looking at organs of the body, such as eyes or kidneys or areas of skin. You treat the patient rather than the eyes or the kidneys or the skin. So the eyes, the kidneys or the skin will all behave in more or less the same way, so they're clustered in that way. A third example would be where you give education, for example, in schools, and you couldn't give education to some children in the class and not into others, so they're naturally clustered in that way. Now, the problem with cluster randomized trials is that the patients within a particular cluster will be more similar than you'd expect simply by chance. So, for example, here we've got clusters of patients, and you can see that there's more stones in this cluster than there are in, for example, this cluster or this cluster. And that's because in different clusters you get different groups of patients. So, for example, in different cities, you might have different ages of patients, you might have different racial mixes or different gender proportions. So when we do a cluster randomized trial, we don't randomize the patients, we randomize the clusters. And since we've got relatively few clusters, we tend to use blocked randomization. So in the previous video, I talked about blocked randomization, where we actually have a fixed block, and in this case it's size 6, and we have 3 red cards and 3 black cards. So we do the randomization. Again, I'm just going to do shuffling, although in reality, of course, we should use a computer. And we also need to order the clusters, so we're ordering them around this way like that. And then we turn over a card to decide which cluster goes where. So it's a black card, so we move the entire cluster to this particular cluster. For example, this patients under this particular doctor will all get the control group. We next turn over the next card, and you can see again it's black. So again, we move all these people into the control group. The next card is red, so we move these cluster to go into the treated group. And then we have this card is black, so again, they go into the control group. And then, almost by definition, these two are both red, so they get to the intervention. So one of the important things about a cluster randomized trial is that this randomization is usually done in advance. So in other words, the clusters know which treatment they're going to get or whether they're in the control group before you even start recruiting patients. And so it can be done in advance, but one of the main difficulties is going to be blindness. So it's very difficult to actually blind a patient to what sort of operation they've had, particularly if it was a fairly obvious one, such as whether you should put a fixator on a fracture or pot it up. It'll be obvious to the patient that what particular treatment they were going to get. So one of the major problems with cluster randomized trials is the difficulty in blinding the patients to the treatment. And one of the ways you could do it, of course, is that if you've got some outcome measure which is fairly subjective, such as quality of life, you could get somebody else to ask the patients about their quality of life. And this assessor is blind to what treatment they're going to get. The other main problem in cluster randomization and cluster randomized trials is what is called recruitment bias. Imagine that you had trained your GP to be really good at looking after people with type 2 diabetes. Now, it's estimated that of those people in the population with type 2 diabetes, only half of them have been diagnosed. So a patient comes to the surgery to somebody who's already been trained to look at people with type 2 diabetes. They may be more likely to spot somebody with type 2 diabetes than somebody in the control group. So you could imagine that since you've already decided the groups, that these doctors in the treated group are more likely to recruit patients than the control group. And you can see this is what's happened in our particular randomization here. All the large clusters are in the treated group and the smaller clusters are in the control group. And that is because the people doing the recruitment are actually more likely to recruit if they're in the treated group than they are in the control group. And the problem there is that you're not really sure whether the two groups are balanced. And so this is a major threat to cluster randomized trials. So there are several ways of trying to get around that, and one of those is that you recruit the patients first and then you randomize, so that you don't recruit them and they know which treatment group they're going to go into. And the other way of doing it is to have a separate group of people who decide whether the patient's eligible for the trial before you do the allocation to, they don't know which particular group they're going to go into. So that the recruitment is separated from the treatment, and then you can try and make sure that in fact you remove this particular threat to the validity of a cluster randomized trial. One noticeable thing about cluster randomized trials is that they have relatively few clusters. So therefore we have to make use of the techniques discussed in the earlier lectures, such as stratified randomization, to try and control as much as possible for differences between the two groups. So the problem with randomization as a cluster level is it is much less able to control for individual variation. So you can see in our randomization of the clusters here that in fact there are far more stones in the treated group than there are in the control group. And the balance of the coloured stones, there are more coloured stones in the treated group than they are in the control group. And that's because the coloured stones seem to cluster in groups, and so it's very difficult to actually balance the distribution of coloured stones.